We've been interested in the problem of older people who come into the hospital and their disease gets treated, but they go home not able to do what they were able to do beforehand. We developed an intervention that we call ACE, Acute Care for Elders, in which patients come to a special unit where the doctors, the nurses, the social workers, the physical therapists have been working together at a much higher level as a team, basically focused on what's necessary to get the patient home as quickly as possible, able to do what they were able to do beforehand. And what we found was that patients who received this ACE care were in the hospital about a day less, 10% less, that the costs of hospitalization were also about 10% less, and that they went home able to do just as much as the patients who stayed in longer, and that they weren't rehospitalized at a rate that was any higher than other patients. So that overall, ACE provided a way of providing patients just as good outcomes as regular care, but saving them about a day in the hospital, never a nice place to be, and saving about 10% in hospital costs.
The important thing to realize is that this is actually the third big randomized controlled trial that's been done over the past 20 years. So this is a program that's really been tested several times, and in every case has been shown to be better than what is usually happening. So I think the key next step is trying to figure out how do we bring this to a bigger audience? How do we get more people to be involved in this type of ACE units? How do we convince hospitals to start building ACE units for all of their older patients?